Mina Aisatu Smaisise. As the Ministry of Health and Sanitation, they continue for give status update about the COVID-19. Sierra Network then at the National Emergency Operations Center concerning the update. Let we listen to the official spokesperson for the COVID-19 response team, Solomon Jamiru, as he give the update and also respond to some questions.
It's a pleasure to be back with you this morning for our daily updates. And we have, as our subject matter experts here, we have Major General Taluva here, and we also have the Chief Security, CST, Victor Manfred Williams, and we have Mr. Will from the Office of National Security, and others will be joining us. Let's go straight to the status update for today, the 7th of May, 2020, and I would ask the official spokesperson, Mr. Solomon Jamiru, to do the updates. Over to you, sir.
Thank you very much, Harold, and good morning, everybody. Status update for 7th May 2020. Total cumulative confirmed positive cases, 231. Total number of deaths, 16. 2 more added, one a 60-year-old male from the Jue Center and another a 57-year-old male from Jue. Active new cases, 6. We recall yesterday we had 225. Active cases at isolation centers, 161. Cumulative recoveries, 54. Number currently in quarantine, 1,744. Number discharged from quarantine, 1,806. So from the 6 active cases, 6 new cases, Koinadugu district has recorded its index, 1. Western area rural, 2. Western area urban, 3. That's the update as at 11 a.m. this morning. So I will start with contact tracing for case 90. Well, this was actually good news as we reported yesterday, because this was becoming a nightmare for all of us, considering the nature of this disease and how it could spread easily in communities. And now with the evidence of community transmission that actually triggered the announcement of the 3 days lockdown, I'm sure all of us as Sierra Leoneans, we are deeply concerned. Now that he has been tracked, we would want to assure the general public that the necessary protocols on contact tracing had been triggered, and those processes are ongoing, and will ensure that all those persons who constitute primary contacts are taken to where they are supposed to be, and eventually after the incubation period, the normal test would be taken, and the public would be informed of the outcome. Pleading for government officials, the possibility they actually government officials then sacrifice their salary for COVID-19. I think say that's an individual decision. We don't know to your suggestion, we don't know to your recommendation. And I believe say government officials also now part of this Zoom, then a part of the public outreach, and then go get to know about this. And your suggestion will go transmit them accordingly. But we believe government officials, as well as all Sierra Leoneans, we are all doing what we can under very modest and difficult circumstances for support the fight against COVID-19. And for that, we want to generally commend everybody, even including public officials and ministers. On WHO and Madagascar, the last time I read, WHO was also very cautious and has been issuing warnings that it takes about 12 to 18 months or so for any medicine to be certified for use. And so WHO has been very, very cautious in terms of the Madagascar organic, as they call it. But we understand that some countries are beginning to canvass its use, and Liberia is one. I'm sure they received some substances from Madagascar. we will wait and see. First of all, we want to commend Madagascar for such an initiative, because at the end of the day, what makes the stories of countries unique would be the local initiatives, efforts, and innovations that they adopt. So this is a commendable thing. Sierra Leone has not taken that step yet, but it is something that we are looking at in great deal. Somebody talked about Dr. Ila, and honestly, I am not aware. In fact, I was just asking Harold who Dr. Ila is. He just notified me that Dr. Ila is in Lunge, no?
Yeah,
the medical superintendent in Lunge. I am not aware that he was here, and I believe there are internal processes on disbursement. So I know say if Dr. Ila become, there is a specific need where he gets. I know say there are authorities, key pillars, then where if we're able to talk to for respond to the need. If there is any inconvenience relating to Dr. Ila or the hospital where they manage, where sometimes they negatively impact on in work, I think say that they don't be brought to the attention of EOC, and I'm sure that that concern, as well as any other concern where they come during the fight against COVID-19, the EOC, they look into them. Lamrana, indeed, yesterday you asked a question on the budget, and as a unit, we have endeavored to make sure that officials be here to speak about it. They could not make it, but that notwithstanding, the fact that we have for now, and I will just lay them bare for the general public to understand. First, 2 accounts were established by the Ministry of Finance, and we will continue to give the assurance to the general public that those accounts will be managed. Funds that are meant for use for the fight against COVID-19 would be managed within the framework of the Public Financial Management Act. Our understanding as a unit is that for the lockdown, several pillars submitted what they call activity plans. Now, those activity plans are the plans for the duration of COVID. I think in some cases, 3-month activity plan, and so forth and so on. So there does not seem to be a specific budget for the 3 days lockdown. Activity plans were submitted, and they ended up to cost those activity plans. So indeed, different pillars undertook activities in the course of the 3 days lockdown, but because of the time that the 3 days lockdown started and from the time that it was announced, some of the activities we are aware may not have been concluded for the duration of the 3 days, which means there is a continuity of implementation. And financially, the experts will tell us that especially for the district EOCs, where monies will be transmitted for implementation, they would also have to send returns to headquarters, and those financial systems will have to be audited at the end of the day. So I am sure that once those returns and once those financial activities are audited, I am pretty sure that those audited accounts will be made public. And I think it's important for Sierra Leoneans to understand. So I am sure that when you have an audited account, it will now give us a comprehensive outlook of what the incomes are and what the expenditure are at the end of the day, and whether there are any other supplemental analysis that the public should be aware of. So that is what we have gathered at this point, that their activity plans were submitted for implementation for the 3 days, but some of those activity plans were not completed. So I think there is the understanding that they should continue implementing them. So you don't really have a budget specifically for 3 days. That is my understanding until there is contrary evidence. So I'm sure that that discussion around that may continue. With respect to part of EOC, whether we are looking at going to King Tom, our team also went to King Tom about 4 days or so ago. Yes, that discussion has been ongoing. We had looked at the possibility of seeing how some of the components here may move to King Tom. We have looked at it, and I think that decision has been taken, because there is really the space here. We have a very serious concern about space, and I think there is need for more spaces to be provided to the EOC. So yes, King Tom, specifically the Sierra Leone Football Academy, is one such facility that has been dedicated to the EOC for use. And some parts of EOC at Wilkinson Road would have to move to King Tom. That is truly the case as you have represented. Whether Koinadugu case is linked, whether Koinadugu case is epi-linked, case investigation on this would continue, and at the end of the day, when that is done, we should be able to tell the public whether Koinadugu is linked to any of the previous cases or whether it forms part and parcel of what we may want to consider as community transmission. Well, I just want to say, in one of the programs, we don't get, I think the fact say this is a calamity, and the fact say Salone, like every other nation, pushed to the wall, it they make Sierra Leoneans, they don't get this sense of innovation more, and for see what are some of the local ideas who we can bring on board for support the fight against COVID-19. So about 3 days or so, together with the coordinator, we'll be able to listen to some Sierra Leoneans some come, we look at the PPEs where they come and say, we think some of these things could be made locally. Some chemists and young doctors then come and they say, they don't look at the WHO prescription on the concoctions for hand sanitizers, and we think these are things you can do locally. I even think, say, Shakadas and some other people that already they do some local one. Like the face mask, they use. Sierra Leoneans, and they do face mask now. They take the normal cloth, they do face mask. So there is a lot of local initiative going around. And somebody tell me about the Sierra Leonean, we also do the hand washing machine, where they use sensor. So for we, it's a beautiful thing, and we think, say, we should be willing to open up more to those local ideas and initiatives. Because at the end of the day, when we write about Salone in story for fight COVID-19, now some of them local ideas will help we in the fight against coronavirus. Now I'm going to make we story very, very interesting. My brother talked just now about death. I just want to wrap up on Dandy because as a government, we go make sure say we do everything we're supposed to do for to save lives. Like the 3 deaths we get yesterday, if we go back to them, I think we had 165 years, 76 and 75 years. 76 years, 75 years, and 65 years. So if you look at death, and again we please for note say, even with ventilators, we try as a country for make sure so we scale up on ventilators, because we don't want to get to the point where you begin get more critical cases, but you don't get the system for handle them. But if you look at the recoveries as well, 54 out of 231, I think it's 20-something%, which is good. 23-24%, which is a fairly good figure. And I think we are testing more. Because the test, I make the positive cases, they come up. I don't know Liberia, their figure as of today, but the last time I watched Liberia figure, where you look at the deaths, you know, and sometimes the reason we talk about, they look at comparisons, we always want to compare within context, because you don't want to give the impression as if, you know, Salone they make more say, then at this, now we don't continue, the people then they die. So even when we do that, we add a lot of human face to comparison, so they do. But when you look at the sub-regional statistics, and we know in other countries, we don't know what they happen. Remember the last time America they accused China, say China they hide in figures. We what they do now Salone now with busy, but you know what in other countries then they do for their own, and they know how they do them, and their own systems. But as a country, and we think so we're very open about this, we think so we're very transparent about this, we're very forthright about this, and anything what they do, they bring the citizens along. You know, in terms of contact tracing, under surveillance, in terms of the testing, what they do, even on testing, we try for scale up. So really, in terms of the deaths that we don't get, 16, it's unfortunate that people lost their lives, but we also go attribute this to within the medical people that can call comorbidity. You know, one day they talk about when some renal, some kidney failure. We don't get a lot of even this one we don't get today. Harold will tell you, say instead get elements of comorbidity, the two that we will get, you know. But whatever we can do, and we continue for count on, we all support. Whatever we can do to save lives, we can save lives. But I think in terms of the fight against coronavirus, Sierra Leone is not doing bad at all.